And if you do not want to be on the recording, you probably won't. I usually just focus on the presentation itself because the main purpose is to teach you something valuable, especially focusing on the good gut-brain connection and specifically how that all affects our weight in a good way or in a bad way. And I'm very happy to have you there. And I love your background there. Is that on vacation, Lita? Oh my God, it looks Mediterranean somewhere, or where is it?
I was in Austin, Texas.
Oh, that's in Texas?
Yeah.
Oh, wow, beautiful hills. I knew they had woods there because I have a friend in Texas and she lived there in the wooded area up in the hills, but I didn't know that the houses look like that. Great. You love it there?
Yeah, that was up on the hill. That was at a restaurant. I don't live there. I was just visiting at the time.
Okay, that's
Yeah.
awesome.
I just have to step away for 1 second. I'll
For
be
sure,
right.
no problem. We'll start in 2 minutes sharp. And I can't wait to give you an overview of all that's to come. Because you don't know that yet, but today will be relatively short and I will let you know why. My mother died 2 days ago in the evening. So yesterday I read to book it. She lives in Germany. She's 92. She was very ill in the last year due to some intervention that she didn't really want to use, but she had to, whatever that is. I'm not talking about that much. And the fact is she was very healthy. She had 91 wonderful years. She was fit as a whiz. And then she got suddenly autoimmune kidney failure and it damaged her brain. And that was in the summer of 2021. And she passed away peacefully 2 days ago at age 92. So we are traveling to Germany in a week. So there's lots to do to prepare. And I'll keep my presentation today a little short, and we will actually push the future presentations that I had planned every week out until I'm back. Make sure that I can focus and give you the best value I can ever do. All righty, let's get started. I'll share the screen. And today, you see if it works. No, of course it doesn't. Okay, where are we? Let's stop the share. Gotta love that when you land on the wrong slide. All righty. I love tech, I really do. But sometimes it is a pain in the belly. Of course, we're talking about gut health. And I like to have fun. I'm a very fun-loving person because I've learned one thing. If you ever want to change any behavior, whether it's eating or whatever, your brain will not do it if you are not enjoying the process. And if you don't have fun while you're learning something new, it will not stick. And as we know from kids that have ADHD and adults with ADHD, they find they can only do things consistently that they find exciting. So what's the solution? To find more things that are really exciting, and even boring tasks like preparing food, cutting onions can be really exciting when done in the right way. And I love how Diana focused on the mindful aspects, because that is one aspect how you can really enjoy the moment and train your brain to succeed and enjoy the moment, release the dopamine that the brain needs to cement a behavior, to cement the habits that you want to change. So that said, let's get started on what's up with my belly. So many people have gut health issues these days, and I want to contribute a little bit to solve the puzzle why that is the case and how gut health, brain health, mental health, and general health and immune system really hangs together. And I go with hypothesis. If you hear the dog barking, that's Rudy, our sparkle dog. Okay, Rudy, I'll close the door. He's a little Pomeranian. I'll introduce him in a little bit. So Hippocrates said, a great Greek physician, all disease begins in the gut. And, you know, he had a point there, because the gut and the gastrointestinal system, and we are really not realizing that often, is kind of our skin put inside. It's the outside world inside us. It's the only part inside our body where we are connected to the outside world directly. All other parts have more or less tight membranes, junctions, and processes to shield us from negative aspects. But our gastrointestinal system, and starting at the mouth, nose, and ending at the anus, is the only system that is directly connected to the outside world that way. So, before I get into too much teaching, I just wanted to let you know that everything I say is educational only, and it's not intended to be a substitute for medical or other professional advice, diagnosis, or treatment. And I want to advise you, always seek the advice of your personal physician or other qualified healthcare provider for your individual condition before you change anything in diet, exercise habits, or lifestyle. Because I have a lot of clients that have health conditions, and I always love to work together with their healthcare provider. Now, if you or somebody you know has an upset stomach, leaky gut, inflammation in their body, suffers from fatigue, from brain fog, chronic pain, is down in the dumps, depression, mental health issue, anxiety, and even food allergies, autoimmune conditions, has skin problems like allergies, eczema, even kids with autism, ADHD, or adults with memory problems and certain types of dementia, then this seminar series is for you, because all those diseases have a root cause, and I say one root cause, but one of the main root causes in their gut. So what I want to do in this seminar series is help you to understand what's really going on in their belly, from the mouth to the anus on the other end, so you can help your practitioner or doctor better. I also want to give you tips how to resolve common problems with natural means. I want to show you how your whole body really depends on your gut health and on your nutrition. And nutrition is not anymore what we just think. And in my previous series, I talked about how the environmental toxins influence our microbiome, and I'll get into this part here too. And I recommend you not only follow me on Eventbrite, but I have a nice YouTube channel that I will tell you about in one of the follow-up emails. Now, what will I teach about in this series? And I will make it a course on my website that those who have attended those events will get access to for free if you look at your emails. So I highly recommend you do so. I want to talk about the structure and function of the digestive system. And I will start with the head and throat, and it will not be boring. It will have anatomical pictures, not gross, but interesting. And I will explain them in a way that regular people that are not doctors can understand. I will not use fancy names. I will explain medical terms if I use them. And then we'll go on to talk about esophagus and stomach, kind of why heartburn is really not anything related to the acid. It's not the acid's fault, as I said in a previous video. Then we'll talk about the small intestines, the large intestines that have a very different function. And then we'll get into the accessory organs, the liver and the gallbladder. The liver is really a giant, wonderful, amazing chemical factory. We'll talk about the pancreas that most of us know as the part where insulin is produced, what is an issue with diabetics. But it's not just that. Pancreas produces a large amount of digestive juices, and the mesentery is an organ by itself that many people have never heard about. Then, of course, we will talk about the gut microbiome. I call it the aliens inside us, because by numbers, we have 10 times more bacteria in our gut than we have cells in our body. So the bacteria outnumbering our cells 10 by 1. We really have the aliens. We are alien, really. And then I talk a little bit about to heal your gut with natural means. And not always is it possible, and not always a natural means the right way to go. And I'm a physician enough to appreciate modern medicine very much. And so I will call today What's Going On, Structures and Functions overview. And we'll talk about how we digest and absorb nutrients, not today, heartburn, heartache, and stomach ulcers, gut microbiome, about elimination. I love to give you the scoop on the poop at some point. And I like to talk about irritable bowel syndrome. Now, this is not nice text formatting, but it doesn't matter. It's not perfect. I've learned one thing: you can never be perfect. And then there's another cause, the inflammatory bowel diseases. I like to talk about that because they are not what you commonly are made to think. Common diseases of liver, pancreas, or gallbladder, inflammation, one of my favorite topics, a volcano ready to erupt. And I like to talk about the barrel model of diseases. I've thought about that in a previous video, and I'll mention it again because it's my favorite disease model. The yin and yang of gut nerves, because really the gut nervous system is our second brain. And the gut and mental health and ADHD and autism have a very intricate connection that many people don't know about. I love Julia Matthews, Bioindividual Nutrition. She talks a lot about hope for autism, for children especially. I'll talk about common medications and foodstuffs, and I say foodstuffs for a reason, and their influence on the gut and nutrition. Then I'll talk about diets that truly heal, which one is right for me and my family, a big issue when it comes to weight loss. There's hundreds out there, and many people are wondering. And home remedies and supplements. As a naturopath, I know a lot about what helps, what doesn't help. And it's interesting that in North America, it's considered to be a contradiction to be a medical doctor and a naturopath. In Germany, where I was trained, it wasn't. I could do both easily. Miracles from nature, herbal and aromatherapies for the gut can be helpful. And also acupuncture, meditation, and mindfulness can enormously help for stomach health. Now, I've told you a lot of things. You might wonder, who is that woman? That's me and my hubby, Mike, and our sparkle dog, Rudi, at our wedding anniversary a few years back. So I'm a German-trained physician. I'm a naturopath. I'm a gastrointestinal disease specialist. I'm an allergologist. I'm also a dermatologist. I was trained, I'm a board-certified dermatologist, allergologist. And then when I came to Canada 25 years ago, I later, after my own bout with depression, gut health issues, chronic pain that I healed with natural means, I became a certified brain health and mental health professional with Dr. Daniel Amen. I have seen his famous New York Times best-selling book, Change Your Brain, Change Your Life. He's my mentor, one of them. I love him. He's very smart. And he also propagates going with all lifestyle modifications and natural means first. I mean, medications are always there. And the more chronic the condition, the more you want to try natural means first. I mean, if I break my arm, I want modern medicine. I want to go to the emergency room. I want it set. I want to get under anesthesia. I'm so grateful we have those means. My own son at 1.5, he had bacterial pneumonia. Antibiotic, modern medicine saved his life. So modern medicine is great. I'm very grateful for, but it needs to be adjusted when it comes to chronic illnesses. The more chronic, the more it needs to be adjusted, in my opinion. So that's why I'm working as a health and life coach, because as such, I can say what I really want, and I'm not bound by professional standards and guidelines that force me to say what certain professionals want me to say, which is sadly a lot the case. I've noticed that in Germany, it's even worse here. So let's go into it. What's going on in your belly? And these are a few little anatomy pictures. We'll see way more about them. And I want to encourage you, if you have any questions about the topics that I'm teaching during the webinar, type them in the chat box. And when we are done, I will answer them one by one. Now let's start with the overview. What we'll talk about is the mouth, and we'll break it down in detail because I'm a sucker for detail. I'm very detail oriented and I want to know everything. We want to know why we have a mouth. What does our teeth, tongue, and the glands in the mouth, what do they do for us? Why are they important? Why do they help us with our digestion? And I'll talk about topics and I'll tell you things that probably most of you never think about. Same with your esophagus and stomach. What are they really doing for us? Are they just sitting there like lifeless organs? And we've learned some things in school, but way not the truth about what they really do for us. We'll talk about the intestines with their different layers and what those do. Of course, about the microbiome, liver, gallbladder, pancreas, the lymphatic system, the immune system, because they're intricately connected in the gut and with the nervous system in the gut. We'll talk about the blood vessels that are crucial, that the health of our blood vessels, and about the gut autonomic nervous system, because we have several nervous systems, exactly 3 in our body. We have the voluntary nervous system that makes us flex our muscles, that we can tell. Then we have the autonomic nervous system that is regulated by different stress hormone levels, and they work together. And then we have the third nervous system, which is the second brain in the gut. All right, what we'll talk about in the nose, tongue, and the mouth is about our sense of smell. And the sense of smell is actually created here in the back of your nose, and then has a direct connection to the limbic system in the brain. And the sense of smell is interestingly the only sense that is directly connected to the limbic system in the brain. And as Diana will know, the limbic system is a system where emotions are processed. So like in many animals, our sense of smell has a direct impact on the emotion center in the brain. It's direct connected, no switch in between, like with many other systems. And that is important because we still react to pheromones, which are hormones. When we smell a human being, say, I'm a woman, I selected my husband by smell. And we'll talk about that more. We do that. We might not be aware of it, but they actually made a test. They had, and that's a funny story, they had husbands and wives that lived together for more than 10 years. They got the husbands to wear the same white t-shirt, 10 husbands, the same white t-shirt, well, different white t-shirt, but the same t-shirt for 3 days, not wash it. And then they mixed the t-shirts. They looked all the same of the 10 husbands in one big pile, and had the wives pick out their husband's t-shirt. And they all were easily able to pick their husband's t-shirt just by the smell. That's how strong the connection is through the sense of smell. And you know that if you ever were in a relationship, you know your partner by smell. You know exactly how they smell. Smells are very important. That's one of the mechanisms why essential oils work. Now, we have a sense of taste, and the sense of smell and taste is intricately connected again. people that lose their sense of smell because of a zinc deficiency, of a viral infection. We heard it about COVID, it can do it, especially when there's a zinc deficiency at the same time. And then they also lose the sense of taste. And of course, there are strokes and other brain diseases that can lead to a loss of taste and smell. And we chew foods to get it ready for digestion, and we start to digest foods in the mouth. And that's why chewing is important. When we just get a hamburger and wolf it down in 2 bites, or those fancy 2-bite brownies, easy to swallow, they are not digested in the food. And saliva, interestingly, also contains antibacterial agents and enzymes that kill the germs, the harmful germs that are in our environment. Now, we'll talk more about the tongue, which is the strongest muscle relative to its size and has taste receptors and different tastes. And one of the tastes that has been, we always thought we had 4 different tastes, but we have more because the sense of umami, the savory taste, has been discovered not long ago. And we will talk about everything, how the food actually goes from the ingestion of the food in our mouth, how it works its way down the esophagus, in the stomach, in the small intestine, and the different ways it gets digested and absorbed, because just because you eat something doesn't mean it nourishes you automatically. Even if you eat a very healthy food, it has to be first ingested, of course, but then comes the chemical digestion in the stomach with the enzymes, the mechanical digestion, the breakdown in the intestines. That's why your stomach rumbles, your belly rumbles sometimes. It's the stomach and the churning the food to break it down in smaller particles. And then it has to be absorbed. It has to get from the gut into the blood. And then the nutrient has to be going from the blood into the organs where they are needed. So it's a very complicated process of metabolism and absorption, digestion working together. And it's really, I always say it's a miracle that it works. It is wondrous. It makes me believe in a higher power, that these complicated processes, it took me years to learn in medical school, actually work without us microtasking is. We don't have to tell our stomach, okay, I ate a slice of bread. Please break it down in the amino acids. Please resorb it and take this amino acid to that cell. No, it's all done for us. Isn't it amazing? We'll talk also about the anatomy of the esophagus. And we have several sphincters or ring muscles that constrict the esophagus, and they are made so they work in sequence, ideally. We have an upper esophageal sphincter, and we know that because, but we also have a lower sphincter. And we all remember maybe that when you were a child, you made an experiment. You stood on your head and could still drink out of a glass with a straw. So it is possible to drink and the food goes uphill in your stomach. Our anatomy makes it possible. So the idea that reflux is just acid going back to your stomach is really nonsense, because what is wrong with acid reflux is not the acid. Kids have very high stomach acid and very seldom gastroesophageal reflux. The thing with the GERD or heartburn is the lower esophageal sphincter is not working properly. And we'll talk about that in a separate event. And we'll talk about how we can influence and heal that with deep belly breathing, for example, by training our diaphragm muscle. There's again another thing. So there's lots of little things that you can do every day to heal your gut in the biggest way. And we'll talk about the different muscle membranes and what they're good for. Oh yeah, Stomach has all these functions, lots and lots, and we'll talk about that more in detail. 3 phases of gastric secretion. It's the vagus nerve. What does it do? It's not just activated by meditation and reduced by stress. There's so much more to it. And we all know the feeling of butterflies in your stomach, or I call it the washroom anxiety, when we have a stressful event and it activates our nervous system and suddenly you have to run to the toilet. That is the second gut in the brain. And I still remember my big exams in medical school. Every time before the exam, I had to run, and I bet the toilets were busy at that time. Small intestine, another wondrous miracle of nature, mixes food with digestive juices and so much more, breaks down products, and we'll talk about all that in detail because I love to teach. Healthy and leaky gut. I know many practitioners still say there is no leaky gut, but the science actually confirms that there is. We have to have a healthy barrier between the outer world in the gut and the inner world on the other side of the cells in the gut. And inflammation and autoimmunity and food sensitivity and allergies are in large part caused by that gut imbalance. Large intestine, oh my God, one of my favorite topics, poop, so important. What does it do? And how can we influence it? How can we avoid nasty things like hemorrhoids, diverticula, and other things that are supposed to be inevitable? They are not. And the large intestine has a very important function. It absorbs most of the leftover water. And there's actually most of your stomach and gut bacteria and the large intestine because it has a much better milieu. Many people don't know that. They think the stomach, the gut bacteria in the stomach. No, they're in the large intestines and the structure and function. And that's why a colonoscopy is so complicated to do. Just ask any gastroenterologist that does it. It's not easy to get it around all those flexures because we have complicated flexures and they all have a reason. And there's trillions of microorganisms in the gut. And yes, there's colon cancer too, and we'll talk about the origins of that too. Now, one of my favorite organs in the body is a mesentery that people often didn't even know exists. They never heard of that. But it is a double fold of the cells inside the stomach that are called peritoneum. And that actually attaches our gut to the stomach wall. And all the blood vessels, all the lymph vessels, all the nerves that are ending in the intestine are contained in those mesentery. And the mesentery contains fatty tissue, the famous intra-abdominal fat that they tell you is a bad fat if you have too much of it, and the risk is a risk factor for heart attack. And it probably is. And the function is not yet well understood. But most scientists that research the mesentery, and there's more and more about it, say it has probably hormonal and immune functions. And we learned in the recent years more and more about the hormones that can impact how much you eat, the leptin, the ghrelin, and all those hormones. And we'll talk about those too. But really, they are produced by the mesentery. But it's more important than to know a little bit about one of the hormones and then jump to conclusions and give all obese people a medication that may block one of those enzymes, and we don't really know what the function is and what all they do. So we have unintended side effects. Instead, first, I think we should try other ways to solve the problem. Now, I love to talk about the liver and gallbladder. It's a wonderful organ. The liver is one of my favorite organs. Well, I'm excited. I love everything about our body, soul, mind. I love it. It's so fascinating. how nature, how the creator did that all together. And I don't know how it happened, but it's wonderful. And there's the anatomy, how it goes together. Where does the blood go from the gut? It does not go straight to your brain. It goes through the liver first. Everything you eat, everything that gets digested and then absorbed and gets into the bloodstream, before it goes anywhere else, first gets filtered and processed by your liver. That's how important your liver is. If you don't have a liver, you're dead. Because if the blood went unfiltered from your gut directly to your organs, there's so many toxic substances in it and nutrients that you cannot use in your cells. We need the chemical factory. It's fascinating. And here's a little bit of the structure of the liver. It's so exciting what it all does. And we'll have some fun with the liver. And the pancreas, oh my God, the underappreciated organ. Yeah, we know it for producing insulin and maybe other glucose regulating hormone. And type 1 diabetics, of course, they know about glucagon too, because they need it if the sugar goes too low. But there's other pancreatic polypeptides, somatostatin. You know, we as scientists, as doctors, often jump to conclusion and think we know it all. But I have to find out who that was. But one famous scientist said the danger is really not the lack of knowledge, but the danger is to think that we know something, and then it turns out not to be true. But the pancreas also produces pancreatic juices like lipase, amylase, nuclease. It's fascinating. And the exocrine function is regulated by all kinds of hormones, including the ghrelin leptins, by the stomach and duodenal cells and the nervous system. And you see how all this intricate works together like a Rubik's Cube with 275 sides. So it is really, really a very fascinating thing. Now, this is today, you'll all get the recording. And a few facts for fun. We all secrete about 1 liter to 1.5 liters. That's about 1.5 quart. I don't know how many ounces that would be. In every day, even while you sleep, we all produce a lot of saliva, and we need it normally. And our saliva contains 95% water. The rest are ions like bicarbonate and phosphate, which are buffers. And we know buffers neutralize acids like stomach acid. They also contain glycoproteins, enzymes that are antimicrobial and kill the bad bacteria that get in your mouth. They contain mucus, they contain IgA, epidermal growth factor. And that's where the saying comes from, a mother's kiss can heal the wound. It's not totally wrong. Now, it depends. If the mother has a bad mouth microbiome, the wound won't heal. And that's where you see that the overuse of antiseptic or antimicrobial mouthwashes is really not helpful. Now, of course, stress, sympathetic stimulation, and dehydration, not drinking enough, reduces saliva production. So if we have too much stress, our mouth dries out, and we know that. And we want to drink more. And many people, of course, they want something carbonated because it stimulates saliva production, just like acid. That's why when people don't have enough saliva, they recommend that they have lemon juice or suck ice cubes or lemon juice. They do that with cancer patients, and it helps enormously. But I recommend if you drink enough, and preferably, of course, water and calorie-free liquids, it reduces the saliva production. We have 2 sets of teeth. We have 20 baby teeth and 32 permanent teeth. Now, many of us had some extracted, me including. We can live with less teeth, but it's interesting what kind of teeth we have, and we'll talk about that. Now, before I go further, I thank you very much, and ask me questions, not just here now, but if you're watching the recording, please feel free to ask me question by emails anytime. And also feel free to, let me see, how can I get rid of the chair? Ask me question right now. Anything you want to know, I'm happy to answer. And if you ever want to talk to me, there's that option too, of course. And you can PM me, you can email me. Yeah, if you're on the call, if you're registered, you have my email. If you're watching that as a replay on my YouTube or wherever you're watching it, feel free to go below where there is some resources that you can click on and send me your questions, and I'll be happy to answer them all. Okay, I got a question. Pain in the right side of your stomach under your ribs, in addition to a cramping pain on the lower right side when bending down. Pain in the right side. That is interesting. And no stones, melasma, yeah. It's interesting. It's a browning color of the skin, and diet affects it. I have to do some research around that. I'm not aware of much that diet affects. Of course, our skin pigment, melatonin, needs certain nutrients to form. And as I firmly believe everything is interconnected, it can well do it. So I will do some research on it. I'm very happy to do that. Pain in the right side of your stomach under your ribs. That can, of course, it's the side of the liver, gallbladder, but also the right kidney and multiple lymph nodes and the right flexure of the large intestine as well of the small intestine. So often I see the same thing, that those pains are caused by other factors than what we can find in a CAT scan, which has, by the way, a resolution of about 1 centimeters, and routine sonograms even worse. And the nuclear scan is probably more a scintigram. And I love to look at those pictures. That's part of what I do for my clients that want a health assessment. So if you're interested, feel free to let me know. I'll send you a link and you can sign up for that, which is a series of questionnaires. I look at all the tests and results that previous physicians have given you. And I'll give you, depending on the level you choose, either a way to do further research on your own, or work with me to get a customized nutrition, health strategy and life plan, or even work with me to implement that. So there's different options in different price points, of course. And everything is affordable. And as I said, I offer a free call that anybody can book that is interested. And all my emails, I read them myself. So if you respond to any of my emails, you get an answer from me. My VAs are not there to answer my personal email. And that said, let me see, I can give you a link if you want to book a call right now, where you can click, because I will travel in about a week, but there's definitely a way to get started and we can just talk. And just give you my link, and I'll put that in the chat box. And if you click on that, it will take you directly to my scheduler. And if you want to know anything more, of course, my website is all over the place. You just Google my name and you find something about me. I hope not many people call me Quark, but if they do, so be it. My husband does sometimes when I tell him things he doesn't like, but too bad. As I said, we got to have fun. And in general, I love people. I care for people. And that's what I do for a job. Thank you very much for your condolences. Yeah, my brother has the hardest time because he lives in Germany. So he is right now, they're arranging for the funeral. And my children, I have 2 sons. My older son lives in London, England, has 2 children of his own. My little baby's grandchildren, Sebastian, he's 3.5, and Vincent, he's just been born a week ago. And my other son lives in Germany still, in Braunschweig, where my practice was. And he has 6 kids, 2 is his own. Oh my God, he has no money. No wonder with 6 kids. How can you? And he's a paranoid schizophrenic, which is very interesting because it runs in the family. And how he became paranoid schizophrenic, I think everybody should know. And when I teach students, I teach on OutSchool, brain health related to mental health. I love that. And what happened is when he was 16, he got heavy into marijuana. And that triggered the psychosis. Yes, Diana. And that is a common occurrence. And it sadly happened to him. But he's fine. He's now in his 40s, and my grandchildren are amazing. All right, thank you so much. I thank you, Lita and Laura, very much for being here. I hope it helped you a little bit along your way, and I'll see you again. Take care. Bye-bye.